If you wake 2, 3, or 4 times each night to use the bathroom, do not dismiss it as an unavoidable price of aging. Nocturia becomes more common later in life, yet repeated awakenings deserve attention because many different problems can produce the same symptom. Tonight, you will learn a practical 5-step evening routine that may reduce avoidable triggers, improve safety, and give your clinician better information. The final step is especially important when fluid collects in your lower legs during the day and returns to circulation after you lie down. This video is educational and cannot diagnose the cause of your symptoms. The narrator is not presented as your doctor, and every person shown is fictional. Nocturia means waking from sleep to urinate, then returning to sleep or trying to return. One trip may be manageable for some people. 2 or more trips can disrupt sleep, energy, balance, mood, and daytime function. Research also links nocturia with a higher risk of falls. That association does not prove that nocturia directly causes every fall. It does show why the symptom and the path to the bathroom both deserve serious attention. Repeated nighttime urination is not one disease with one hormonal explanation. It can reflect excess urine production, reduced bladder storage, incomplete emptying, a sleep disorder, medication effects, or several factors together. Diabetes, kidney disease, heart problems, swollen legs, urinary infection, prostate enlargement, overactive bladder, and obstructive sleep apnea can all contribute. Age-related changes in nighttime water regulation may matter for some people. They are not a complete explanation for everyone. That is why a supplement or strict drinking rule cannot safely solve every case. Before changing your routine, notice the warning signs. Seek prompt medical advice for blood in the urine, burning, fever, new pelvic pain, or a sudden major change. Complete inability to urinate with lower abdominal pain requires urgent care. New shortness of breath, chest discomfort, or rapidly increasing leg swelling also needs timely assessment. Excessive thirst, unexpected weight loss, a weak stream, or difficulty emptying the bladder should be discussed with a clinician. Persistent nocturia deserves evaluation even without these warnings, especially when it is new, worsening, or causing falls. If this clear safety first approach is useful, subscribe so you can follow the complete Vital 60 series. The most useful starting tool is a 3-day bladder diary. For 3 complete days, record when and how much you drink. Record every bathroom visit, the approximate urine volume, your bedtime, and each awakening. Note urgency, leakage, ankle swelling, caffeine, alcohol, and any medicine taken near bedtime. Include the first morning urination, because clinicians often count it when estimating nighttime urine production. Do not change everything while collecting the baseline. The diary works best when it shows your normal pattern. The pattern can reveal important clues. Large nighttime volumes may suggest that your body is producing too much urine during sleep. Small frequent volumes may point toward bladder storage, irritation, or incomplete emptying. Waking first for pain, noise, anxiety, or breathing trouble may mean sleep disruption comes before the bathroom trip. Swollen ankles that improve by morning can suggest fluid redistribution. These observations are not diagnoses. They help a clinician decide whether to review urine tests, blood sugar, kidney function, sleep apnea, medications, bladder function, or prostate symptoms. Nighttime urine production is controlled by more than one signal. Kidney function, salt handling, circulation, sleep, and hormones all interact across the day. Vasopressin helps the body conserve water, but its rhythm differs among individuals and conditions. Calling every case an age-related hormone collapse is inaccurate. It can distract from treatable causes, including sleep apnea or poorly controlled diabetes. The safer question is not which hormone failed. The safer question is whether the diary shows excess production, limited storage, disrupted sleep, or a mixed pattern that needs evaluation. Now let us build the 5-step evening routine. Treat it as a measured experiment, not a guaranteed cure. Keep your normal medical care in place. Do not stop prescribed medicines or move a diuretic to another time without professional guidance. Water tablets may increase urine production because that is their intended effect. Changing their timing can affect blood pressure, swelling, kidneys, and other conditions. Your pharmacist or prescriber can decide whether an adjustment is appropriate. Step 1 is to move more of your drinking earlier without becoming dehydrated. The goal is not to force a universal daily amount. Fluid needs vary with body size, weather, activity, kidney function, heart conditions, and medication. Start by avoiding large drinks during the final 2 hours before bed. Use small sips when you are thirsty or need medicine. Spread suitable fluids through the morning and afternoon instead of catching up at dinner. Look closely at evening habits that quietly add volume. A large bowl of soup, several cups of herbal tea, watery fruit, ice cream, and repeated glasses can add up. You do not need to fear food or water. You need an honest picture of timing and quantity. If your clinician has prescribed a fluid target or restriction, follow that personalized plan. People with kidney or heart disease should not invent a new fluid schedule from a general video. Share this video with someone who keeps a full water bottle beside the bed and wonders why the night feels fragmented. Try step 1 for several nights while continuing the diary. Compare the number of awakenings, the volume passed, and how thirsty you feel. If urine becomes very dark, dizziness appears, or daytime thirst becomes uncomfortable, the plan may be too restrictive. Return to a safer intake and ask for guidance. The purpose is to reduce unnecessary late loading, not to create dehydration. A useful routine should support health while producing information you can discuss. Step 2 is to reduce evening caffeine and alcohol. Both can interfere with sleep, and caffeine may increase urgency in sensitive bladders. Alcohol can suppress normal nighttime water regulation and make balance worse when you stand in darkness. Coffee is not the only source of caffeine. Tea, cola, energy drinks, chocolate, and some pain or cold products may contain it. Check labels or ask a pharmacist when you are unsure. Begin with a realistic cutoff rather than an absolute rule for everyone. If bedtime is 10, try keeping caffeinated drinks to the morning for 1 week. If you currently drink several servings, reduce gradually to avoid headaches. Replace the ritual with a small, non-caffeinated option earlier in the evening. Avoid using alcohol as a sleep aid. It may make you drowsy at first, but sleep often becomes lighter and more fragmented later. Leave a comment describing which evening drink would be easiest for you to move earlier. Some people blame acidic foods, carbonation, or artificial sweeteners for every bladder symptom. Individual sensitivity exists, but broad elimination can make eating needlessly restrictive. Test one suspected trigger at a time and use your diary. Remove it for several days, then observe whether urgency or frequency changes. A repeatable pattern is more useful than a long forbidden list. Discuss persistent irritation with a clinician because infections, stones, or other conditions can feel similar. Sleep itself deserves attention because a person may awaken first and urinate second. Snoring, gasping, restless legs, chronic pain, anxiety, and an uncomfortable room can fragment sleep. Once awake, even a partly filled bladder may feel difficult to ignore. Improving sleep habits will not treat every urinary condition, but it can reduce avoidable awakenings. Keep a regular sleep schedule, limit bright stimulation near bedtime, and make the room comfortable. If breathing pauses or severe daytime sleepiness occur, request medical screening rather than relying on a bedtime product. Step 3 is to help daytime leg fluid return before you sleep. This step matters most when socks leave marks, shoes tighten by evening, or ankle swelling appears. Sit or lie in a safe position during the late afternoon or early evening. Elevate your lower legs comfortably, with support beneath the calves. Do not force painful positions, and do not place pressure directly behind the knees. Gentle ankle pumps can accompany elevation if movement is safe for you. Point and flex the feet slowly, then relax. Stop if you develop pain, cramping, dizziness, or shortness of breath. The aim is to encourage ordinary circulation before bedtime, not to perform strenuous exercise. When fluid returns to the bloodstream earlier, the kidneys may process more of it before sleep. Evidence for the exact benefit varies, so watch your own diary rather than expecting a fixed reduction. Compression stockings may help selected people with dependent swelling, but they are not an automatic purchase. Correct pressure and fit matter. They may be unsuitable with certain arterial, skin, nerve, or heart problems. Ask a clinician whether they are appropriate, especially if swelling is new, one-sided, painful, red, or warm. Sudden one-sided swelling can require urgent evaluation. Never massage a painful swollen calf while waiting for advice. When discussing swelling, describe when it appears and whether both legs are affected. Note skin color, warmth, pain, breathlessness, and changes in body weight. These details help distinguish ordinary dependent pooling from conditions needing faster attention. Elevation is a supportive habit, not a test that rules out heart, kidney, vein, or lymph problems. If a clinician has given positioning instructions, follow those directions. People who become breathless while lying flat may need a different position and prompt medical review rather than a longer elevation session. Step 4 is to prepare your bladder and your bedroom. Use the bathroom shortly before getting into bed, but do not strain or repeatedly force extra trips. Give yourself time to relax. If you often feel incompletely empty, mention that symptom during medical review. A clinician may assess urine flow or the amount remaining after urination. That information is safer than guessing that the bladder is weak. Next, make the route to the bathroom safer. Keep the floor clear of cords, loose rugs, shoes, and clutter. Use a nightlight or motion-activated lighting from bed to bathroom. Place glasses, a stable walking aid, and supportive footwear where you can reach them. Rise slowly, sit at the edge of the bed, and let dizziness settle before walking. Grab bars and secure handrails may help where professionally installed. Give this video a like if the safety step changed how you think about nocturia. Do not race the urge. Rushing in darkness can turn one symptom into a serious injury. If urgency is severe, ask about bladder training, pelvic floor therapy, or bedside equipment chosen for your mobility. Avoid improvised containers or unstable furniture. Anyone who has fallen, nearly fallen, or feels unsteady should request a fall risk review. Medication side effects, vision, blood pressure changes, muscle weakness, and footwear can all influence nighttime safety. Measure the environment as carefully as the bladder. From your usual sleeping position, check whether the light switch, glasses, and walking aid are reachable. Walk the route during daylight and remove anything that narrows it. Make sure pets cannot settle where your feet first land. Test that rugs do not slide and that footwear grips the floor. If you use a cane or walker, do not leave it across the room. A safer route does not reduce urine production, but it reduces the harm that can follow an urgent awakening. Step 5 is the review that prevents a routine from hiding a medical cause. After 7 nights, compare the diary with your baseline. Count awakenings, but also examine volume, urgency, sleep quality, swelling, thirst, and morning energy. Improvement can support continuing safe habits. No change is still useful information. Worsening symptoms are a reason to stop experimenting and seek assessment rather than adding more supplements. Bring the 3-day baseline and the 7-night follow-up to your appointment. List every prescription, over-the-counter product, and supplement. Include when you take each one. Mention snoring, witnessed breathing pauses, morning headaches, and daytime sleepiness because sleep apnea can contribute. Mention swelling, breathlessness, and rapid weight changes because circulation may matter. Mention thirst and frequent daytime urination because blood sugar or another cause may need investigation. Women and men can both experience nocturia, and neither should assume the explanation is automatically the prostate. In men, prostate enlargement may reduce flow or emptying. In women, pelvic floor and bladder conditions may contribute. In everyone, sleep, kidneys, circulation, hormones, medication, and behavior can overlap. A urine test, examination, bladder diary, and selected blood tests can help separate those paths. Treatment should follow the pattern that is actually present. Be cautious with products promoted as nighttime bladder cures. Magnesium, melatonin, herbal blends, gelatin drinks, and concentrated juices are not universal nocturia treatments. They can interact with medicines, add fluid or sugar, and create risks with kidney disease. A natural label does not guarantee safety or effectiveness. Desmopressin and other prescription options also require clinical selection and monitoring. Older adults can be vulnerable to dangerous sodium changes, so medication decisions belong with a qualified prescriber. Set realistic expectations for the diary experiment. A helpful result might be fewer awakenings, a longer first sleep period, less urgency, or a clearer cause. Improvement does not prove that every underlying issue has disappeared. Lack of improvement does not mean you failed. It means simple timing changes were insufficient. Bring that finding to the appointment. A clinician can then focus on the pattern instead of repeating generic advice. Good care may involve primary care, urology, sleep medicine, cardiology, kidney care, or pelvic health, depending on what the evaluation reveals. Keep the experiment simple enough to repeat. Consistency makes the diary much easier to interpret clearly. Several simultaneous changes can hide the habit, symptom, or medical factor that actually influenced each measured night during that week. Here's the complete routine in sequence. During the day, hydrate according to your personal plan and record your pattern. In the evening, avoid large drinks close to bed. Move caffeine earlier and avoid alcohol as a sleep strategy. If dependent swelling is familiar and elevation is safe, elevate your legs earlier. Empty your bladder before bed without straining. Light the route, remove hazards, and rise slowly. Then review the results instead of assuming success. This routine may reduce avoidable triggers, but its greatest value is clarity. It separates habits you can change from warning signs that need care. It also replaces an exaggerated hormone story with a more accurate message. Nighttime urination can involve nighttime urine production, bladder capacity, incomplete emptying, disturbed sleep, or systemic illness. Common age-related changes may contribute, yet persistent symptoms should not be dismissed merely because you are older. Contact a clinician soon if nocturia regularly disrupts your sleep or daily function. Seek prompt help for blood, burning, fever, pelvic pain, new severe swelling, excessive thirst, or a sudden change. Seek urgent care if you cannot urinate, have severe lower abdominal pain, struggle to breathe, or develop chest discomfort. These safeguards matter more than completing any evening routine. For the next week, change only the safe factors that fit your health plan. Keep the diary beside a measuring container, not beside an oversized drink. Review what happened with curiosity rather than blame. Better sleep may come from several small corrections or from treating an underlying condition. Either result is progress because you are replacing guesswork with evidence. Subscribe for more practical guidance designed for life after 60, and bring your questions to a licensed clinician who knows your history. Your nights deserve attention, your path deserves light, and your symptoms deserve an explanation based on your actual pattern.